Through my emphasis, I also attended weekly consultation meetings with members from the athletics department to help provide consultation regarding student needs, accessing to resources, etc.
I'm located at the Warren College, specifically in the computer science and engineering building. And for that role, that means I do work with students in Warren College, a lot of students in STEM and engineering.
I was stationed at Eleanor Roosevelt College, and it's a very communal and centered college as well too. So we're constantly checking in with each other in the hallways. If you're not in session or not in meetings, everyone really genuinely wants to get to know you. And I think that really forms a really strong connection with everyone to support those consultation roles.
Work with a few other groups of CAP staff together to serve the college. And you do that through, for example, the Student of Concern meetings, which in a nutshell is providing consultation to administrative staff, deans, related to students who are who've gotten into their radar for academic or mental health concerns, for instance.
Although as postdocs we serve all the students, we do tend to be a little bit more connected and be in the know about how our college students are doing. So for example, I just remember going in and doing consultations, not only during Students of Concern meetings, but for example, there were other opportunities to consult. Let's say the college dean or the academic advisors had questions on certain assignments or areas of concern in which brought up mental health concerns. They had approached me and my other college partners from CAPS to give our input on, is this something that we should further follow up on? What should we do in this situation? Is this a threat situation? Should we assess for this? And
it really lends itself well to our skills as psychologists to be able to be embedded with the other providers.
For myself at the college, there's a lot of consultation that happened informally within the hallways, just us bumping into each other. Folks would ask questions about what's new at CAPS or what are some of the current groups or workshops that you all are offering. And then I also had some more formal consultation spaces, such as biweekly academic advisor meetings when I would meet with all the academic advisors, let them know of some trends, some resources for our students. Myself and my colleague also would take information back from the academic advisors as well too, any feedback about CAPS or any resources that might be needed that we weren't currently offering, so that we could try to encourage that at CAPS to meet the student needs.
In my year was a transition of returning to in-person work, and I really grew to understand and appreciate the role that we had in being physically present, as others mentioned, to be able to have just those in-the-moment consultation meetings. I noticed the more that we were readily present in the offices, the more that the providers knew we were there, the more consults we would get, the more they would come up and meet us in the office.
Just pop down the hallway and consult with a provider who might be seeing a student or is interested in referring a student potentially on, or how they should maybe approach treatment themselves, or even how to speak with a student and to promote them engaging in care. And in fact, just the other day, giving a provider feedback. They were asking for some feedback about how they approach a student and if they would have recommended anything different.
I also attended the weekly SOC meetings as well too, and for that I could provide maybe more general information about what's offered at CAPS or general information regarding mental health treatment.
It also led to, particularly within the behavioral health model, given that it's co-treatment, so we're working alongside the providers who may see someone in urgent care, for example, that we were really readily able to assist, whether that was a consultation on how to manage a situation, a co-treatment, so going in and working with the student in an exam room, or a warm handoff or referral. So just getting to know the student and identifying sort of the work that we would be doing together and helping to support them.
Additionally, something else that we, psychology, behavioral health has been supporting the student health services with is also with rolling out recently the having all students who enter care at student health services receive a PHQ. And so we provided guidance on how to interpret that and really helped create and craft the approach to handling scores on those measures.
The opportunities for consultation, being physically present there, lent a lot of accessibility and availability for that consultation that I don't know would have been as readily available in even something like a secure chat that might still be immediate, or if we were in the CAPS office, several buildings away in a different way. It really lent to this ease of consultation and connecting with the staff.
It was also a really great learning opportunity for myself because I really felt right from the beginning that folks were aware of this as one of the last training opportunities for me, but were really welcoming and respectful of the information that I had and my consultation abilities.
As a postdoc, it gave me the opportunity to move into a consultant role, just as it is wearing other hats as we do here as as a clinician, as an outreach facilitator, and as an advocate for our students.
We definitely are utilized as mental health providers over at Student Health Services and definitely are an integral part of that team and are respected as such, which is very nice.